A very good morning, students. In this video, I am going to talk about the important viva questions which are usually asked by examiner for the first read. Please remember that the viva on first reads are very important. Usually they are asked if the examiner is sitting on the table of the osteology section of thorax, he is definitely going to ask about the first rib. If he is not asking anything else from the thorax, the vertebrae and ribs are usually asked. So please be careful. Now, the most of the illustrations and diagram I have taken from this book Human Osteology, which was authored by me and published by the PP publisher Delhi. This is a good book for the undergraduate as well as the postgraduate student, and I am thankful for the PP publisher for using these diagrams. Now, if you see the first rib as we have seen in our last video is classified as atypical rib because its features, anatomical features, they don't resemble with any other rib, okay? This is the shortest rib, flat rib, and doesn't show any twisting, which are the peculiarity of the other ribs. Okay, so we will learn about the various parts of the first ribs and the question based on the first ribs. If you will see the first rib, okay, the first question will come to you probably will be that how you have identified that it is the first rib. If you said that it is naturally, okay, it is very easy to say this bone as the first rib because you reply that it is the shortest bone, shortest rib among all other ribs. It is the shortest, it is the flat, and it is non-twisted bone. Okay, it is showing the two surfaces, a superior surface where pointer is moving, and there is the opposite surface is the inferior surface. Then he may ask you how you have identified that this is a superior surface. You say that the superior surface shows the grooves where I am moving the pointer. It shows a tubercle, the scalene tubercle. There are roughening of the attachment for the muscle and for the ligaments where this pointer is moving, and this is the reason why the superior surface is rough as compared to the inferior surface, which is perfectly smooth. So just so say him this many reasons how you have identified superior surface as compared to that of inferior surface. Then you say that I have identified it as a first rib because here that means there is no angle or angle correspond to the site where there is a tubercle is present. Okay, tubercle is present here. So you can say that also that there is superior and inferior surface, and that is the reason why there is internal and external border or internal and outer border, okay, is there. And this the inner border is the concave and the outer border is the convex border is there. Okay, and this is because it is flat bone and it is not twisted, and this is in comparison to that of the typical rib, which shows outer surface and inner surface, upper border and the lower border. These are the reasons why I have identified it as the true, I will say, as the first rib, which is an atypical rib. Then the question may come, what are the parts of the posterior end? You say that the posterior end is having a head most medialis, and then there is a rounded neck, okay, and then there is a tubercle, which is the articular and non-articular part of the tubercle. You say that the head, if we see, there will be a single facet for the articulation with the body of the first rib. The rest of the other bones means typical bones. They will show, I will say typical ribs, they will show the two facets on the head, one for the upper body and another for corresponding lower body, thoracic vertebral body. Okay, thoracic vertebral body. The neck is rounded and it is not showing the borders, superior and inferior border, as it is visible in that of the other ribs. Here the superior border and all other borders, they are rounded borders because it is rounded in structure, where in typical rib that was superior border was sharp border. Okay, similarly you can say that the angle and tubercle, they are just at one point. Otherwise in the typical ribs the angle was away from or lateral to that of the tubercle. Okay, lateral to the tubercle. So these are the various features which are only for that of the first ribs. Okay, first ribs. Then the question may come that after knowing this many bony feature, how you will identify the side of the first rib, whether it belongs to right side or to that of the left side. You say that I will identify first and distinguish whether it is superior border or superior surface or inner inferior, which I just told you about the features by which you will be able to identify. Keep the superior surface upward, keep the posterior and towards the posterior side near the midline, and then anterior and anteriorly, okay, which will articulate with the first costal cartilage. Okay, first costal cartilage. Then the inner border, which is concave inside, should face inside, and this will give you the side of the bone. Just keep in this, by keeping, I mean say, keeping these facts in mind, you just put the bone in such a way, so this will give you the side. For example, the bone shown in this photograph is that of the left side. Okay, it is of the left side. Then next question will come that how you will identify the anatomical position of this bone. So keep the bone in such a way that the upper end is at a higher level as compared to the level lower, the anterior end. So upper end higher and anterior end, the posterior end is at a higher level and the anterior end is that of at a lower level. Okay, and this will give you the position. Since there is no twisting here, it is the flat surface is there, it will be easy to just keep it into the anatomic position. Then there will be further questions on the parts of the ribs. Okay, the posterior end, you say that it has three parts. Okay, when you ask define the posterior end, then you say it has three parts: a head, a neck, and a tubercle. Tubercle has two different parts: a articular part which is a smooth facet and a non-articular part which is rough. You say that, as I already said you, that the head is having a single facet for articulation with the first body of the first thoracic vertebrae, and that forms the costovertebral joint, while the the articular part of the tubercle will articulate with the transverse process of the first vertebra, and it will form the joint what is called as the costotransverse joint. Neck is rounded here. Okay, as I said. Then there may be a question on the shaft. Then again he may ask you how you have identified the superior surface of shaft. Again you say that it is a scalene tubercle, and in front of the scalene tubercle there is a wide groove, and this groove is for the subclavian vein. Similarly, the posterior to the scalene tubercle there is a groove which is also wide. This is for the subclavian artery and the lower trunk of the brachial plexus. The rest of the surface of the superior surface will be having roughening for the attachment of muscles and that of the ligament. Okay, ligaments like that. And then you can also point out that on inferior surface there is absence of the subcostal groove, which is the peculiarity of the typical ribs. Okay, all other ribs will show the subcostal groove except the floating ribs, then which is absent here in the first rib. Then important questions on the first rib will be there. What are the relations of the neck of the first, anterior aspect of the neck of the first? This is an important question. You should learn it, okay, thoroughly. And he may ask you what are the structures which are related on the anterior surface from medial to lateral side. You say that most medially it is sympathetic chain, and there may be a ganglia also. Then lateral to sympathetic chain is the intercostal vein is related, superior intercostal vein, and then just lateral to it is the artery, superior intercostal artery is related, and then it is the first thoracic nerve, spinal nerve, which is going from below upward to take part in the formation of the brachial plexus. Okay, so this is the T1 or thoracic first nerve, spinal nerve. Then you say that there is a tubercle which is on medial border of the rib, and that was the scalene tubercle we have discussed. It will give attachment to a muscle, that is insertion to the tendinous insertion to a muscle called as scalenus anterior muscle, which is coming from neck and running downward. Okay, then you say that in front of this scalene tubercle there is a shallow groove which will give which will be in relation to that of the subclavian vein, and then posterior to this scalene the groove is related to the subclavian artery and the lower trunk of the brachial plexus. Still posterior to this posterior groove, which is for subclavian artery and the lower trunk, there is a rough area near the medial border and superior surface. This is for the insertion of the scalenus medius muscle. This means that the subclavian artery and lower trunk of brachial plexus, they lie between the insertion of scalenus anterior and the medius, which are coming from neck, okay, and getting attachment onto the rib. Okay, on the outer border you may show there is the attachment of the serratus anterior muscle, or first digitation of serratus anterior muscle. Near the anterior end on superior surface you will see a rough area which is giving the attachment to the costoclavicular ligament, which is going to the under surface of the clavicle, okay, in the medial end of the clavicle. Then there will be a rough area for the origin of the subclavius muscle, which will go and attach onto the under surface of the clavicus in subclavian groove. Okay, so this is that subclavius groove, and this is the region that so many structures are in relation to the superior surface. Superior surface is rough, okay, and inferior surface is smooth, which is in relation to the parietal pleura. Okay, it is in relation. I thank you very much for watching this video, which is an important video for the viva on the first